Now, what were the questions asked today in the Neet PG examinations? So we will directly, without wasting any time, we will go directly to the what are the types of questions asked and where from they were asked. So let's start first. So overall, the first question which was asked was about the jugular foramen. What are the contents which pass through the jugular foramen? So as you can see over here, there is the jugular foramen, and here we have mentioned in detail what passes through anterior part, what passes through the middle part, and what passes through the posterior part. So you have to remember the question which was asked, the nerves, 9th, 10th, and 11th nerves. So we are well aware of the glossopharyngeal, the vagus, and the axillary nerves which pass through jugular foramen. That was the first question in anatomy. Now going second question, these are the sample pictures from Neet PG QR and Platinum QBank. So second question asked was meryalgia paresthetica, and which nerve is affected in meryalgia paresthetica. So as far as I will not be going in the details, the questions asked directly and the types of questions, I will not go through the options, but you have to remember the lateral cutaneous nerve of the thigh. And I had already emphasized these important facts. So my point is that why to waste time in some unnecessary things once we already have 90, 80, or more than 75% of the questions coming from something. So meryalgia paresthetica, lateral cutaneous nerve of the thigh. This is not for the students presently. This is for the students who are appearing for the next examination as well. They should know what exactly to study. Now, in there, I have pointed out all the other things which are of importance for future examinations as well. Now, then the third question asked was in relation to the epiploic foramen, which of the vessel perforates and causes ulceration, which artery perforates, and you have to remember that I had already emphasized the gastroduodenal artery. So the gastroduodenal artery is one important vessel in which the ulcers along the gastroduodenal artery, and this ulcer corrodes the important structure in there, and it arises from the common hepatic artery. So any vessel which causes massive ulceration, especially in the region of the epiploic foramen and the gastroduodenal artery, I had emphasized, I had put up a full question as you can see over here, and I have given a history of the question in the same pattern as the USMLE questions tend to be. Here in this a good concept, a conceptual question, and you are asked about the gastroduodenal artery. Now, many terms you have to remember, you have to be very specific about what is asked. There was a diagram given of a transitional epithelium, and you have to remember the other alternative name for transitional epithelium is urothelium. And in here, I have already mentioned the features of urothelium. It is a transitional type of epithelium. So no doubt about that. You have to remember epithelia, the disposition of the epithelia, what the epithelia are disposed, what is the cuboidal, what is the columnar, what is the stratified squamous, all those things, or the simple squamous. So I will not go to that. Then the question asked about mylohyoid. Mylohyoid nerve supply to the mylohyoid muscle. So as far as you are concerned, simple conceptual. Pharyngeal arches, 1, 2, 3, 4, 6. 5 does not exist. And you have to remember the nerve supply of each pharyngeal arch and the derivatives of each pharyngeal arch. You cannot remember individual muscles and the nerve supply to each muscle. Mylohyoid tends to be the muscle of the first arch. And as you are well aware, the nerve supply to the mylohyoid is mandibular. Mandibular, M for M. So mandibular mylohyoid. So it is given over here. So mandibular nerve is the nerve supply. That was the question asked. Now, double aortic arch is due to anomaly of which arch? It is the right fourth aortic arch, and I will not go into details over here. The details are mentioned in this explanation over here, and you have to just remember these arch anomalies. Very important. So pharyngeal apparatus, pharyngeal arches, pharyngeal pouches, and pharyngeal clefts. You expect a question from derivatives as well as, neural crest derivatives, endoderm, ectoderm, mesoderm. These are very important questions. You cannot miss them. Then, along the injury to the ankle joint, the ligament which was injured. So you have to remember the various important ligaments attached to the ankle joint. And in a detail over here, I have even just, I mean to say, given in detail. Normally we do not give much detail about many ligaments except for the hip, the knee, and the ankle. In here, I have just mentioned, as you can see, the superficial fiber separately and the D fibers separately. So you can get the explanation of the ligamentous injury to the ankle joint, which was asked from this. So that's another important point. Now, going to pathology, I just would try to go through the questions in a very fast manner. So what is the role of caspases? So you should be very well aware that there are certain pro-apoptotic factors, and I have here listed the pro-apoptotic factors, a list of them. So you have to remember them. This is a simple one-liner, and you have to remember these things. So anti-apoptotic factors, pro-apoptotic factors. Then there was a clinical scenario given of a post-menopausal female bleeding and after 1 year of amenorrhea in the menopausal age. And you have to remember that the most common is the endometrial cancer. And endometrial cancer was given as a figure-based question, but you have to remember the most common cause of post-menopausal bleeding in the developed world is endometrial cancer. That's very important. Now, there was this image-based question given about focal nodular hyperplasia, and in here, in my book, I have tried to distinguish between the adenoma and the focal nodular hyperplasia. So you have to remember that there are four options which were given: hepatic adenoma, fibrocellular carcinoma, hepatocellular carcinoma, and focal nodular hyperplasia with a central scar. So you have to remember out of all these things, focal nodular hyperplasia, how we distinguish it from, and I have given it here. I will not go to the options. Now, another question given was about a male with anemia, jaundice, and spherocytosis. And overall, the osmotic fragility test, which was mentioned over here, and you have to remember that in addition to that, the question was having a heredity trend. So I have not just highlighted this thing. So heredity is the word, because heredity spherocytosis is one of the conditions which just has got increased MCSC, and that was given in the question: increased mean corpuscular hemoglobin concentration. Very important. So heredity trend, increase in MCSC, and what I just mentioned was the osmotic fragility test is positive. That's very important. So it is done. There can be a slight confusion with sickle cell anemia, but there was no, there was no other condition indicative of sickle cell crisis, but heredity trend over here. And classically, spherocytes in the PBF with increase in MCSC. So that's very important. Now, this important thing, faggot cells. In Neet PG QR, I had already specified that these are high yield questions which might be asked. And faggot cell, I'm very happy, very glad to see that the faggot cell was asked, and the characteristics, there were options given as leukemia, lymphoma, CLL, other types, but it is the AML type M3 especially, wherein you have got the faggot cells seen. So I will not go into description, it is all given here, and I'm just there to show you the proof that it was as expected and it has come, and the answers are there as you can see. Then important, amyloid deposition. There are four options given: follicular, Hearthley, papillary, and anaplastic. Wherein you have the amyloid, follicular, you exclude follicular, you exclude papillary, you exclude anaplastic, and the only thing which comes to the mind as a pathologist is the medullary carcinoma thyroid. That's important. So many features with medullary carcinoma thyroid associated with Men's syndrome, amyloid stroma, and many other features, but I will not go. I will just go by the question. The cash line was amyloid stroma. I will not go into Congo red and all those apple green bifurcations and all those things. Then this is something image-based platinum Q3. the third volume, it was especially, and there is a homogeneous, simply a picture taken just as if it was from my book. So seminoma, a homogeneous concentration of testicular biopsy, and you had to identify the tumor based on the smooth and the arrangement of the cells. I mean to say seminoma and after orchidectomy. So that's important. So here is the image, and this is a question. What I can say, a direct question. So important. I have mentioned. Now, if you just a uniform arrangement, which I emphasized, I have emphasized in my question line the uniform arrangement of the cells, and that's classic of seminoma as far as the testicular tumors are concerned. Then question asked quite few days back in FMGE and over here, Marfan syndrome, and this is the pathology section of my book, and you can see over here it is well, I mean to say, demarcated, and in here I would just try to focus these on the question itself. So mutation in the gene, fibrillin gene FIBN1. So fibrillin gene, and I have also mentioned the chromosome number and the arm of the chromosome. Very few books have given it, but I had expected this question in my previous lectures. So over here, this is the question, and I have not given it. It's also, I have given it the clinical scenario: high arch palate, scoliosis, maybe myxomatous degeneration, mitral valve prolapse, your lens dislocation. I will not go into those details, just concerned about the gene and Marfan's. I have been emphasizing. And then there was a slide given about a patient with a swollen leg, and a slide in microbiology about which is the organism. So if you have got elephantiasis, I think that nothing should come to your mind other than filariasis in the first place. So this is something, see, organisms and characteristics, what they cause. So this is a list over here I have given, and in here, if you remember lymphedema and elephantiasis, I have just mentioned filariasis, and you have to identify. The question was simple: filaria. Now, important, sometimes we just concentrate on clinical scenarios, all those things, but here the question was given as rhomboid crystals. So it is already highlighted in here, rhomboid. I would not, I mean to say that, why are the rhomboid crystals present? There was a huge scenario given, hardly matters. Sometimes in a big question, there is one point which takes you towards the ultimate answer. That's why I am emphasizing again and again that you have to go through the question lines very, I mean to say, very seriously, with a lot of concentration. Rhomboid crystals, pseudogout. Elderly, rhomboid crystals, pseudogout. So answer over here would be, my question was different, but I'm giving you just the explanation of the question and pseudogout. Now there is a question, I have given it my image-based book over here. You can see over here. A disc protrusion at almost at 3 places, and I have just mentioned it, multiple disc desiccations, and this was mentioned in the question. So nothing, these are all original x-rays from my own source, nothing copied, nothing downloaded from anywhere. So this is something which is important. So you have to identify these radiographs. Perthes disease. In a child, a clinical scenario was given, Perthes disease, and it was shown the osteochondritis of the head of the femur. The head of the femur was shown, and it had osteochondritis in a child, and the condition was Perthes disease. A diagram of congenital diaphragmatic hernia. You can see the bowel loops in the thorax. I would not go further. So this is characteristic. On auscultation, you don't feel the bowel sounds in the thorax, and over here I have shown. There's you cannot get a better radiograph, and this is my. I just am pleased that this radiograph was given to me by my friend, and I'm very much obliged to him that it helped some students over here. And thanks a lot to him. I would not mention his name though over here, so I have given him due credit in my book. So and then carotid body tumor. You were given a scenario of a tumor arising from the paraganglionic cells with pulsations, and there can be no other choice which is mentioned other than the carotid body tumor. Another question in radiology mentioning just one thing, and this is just a screenshot from my book Neet PG QR, just mentioning a dural tail sign. And you know, meningioma, benign tumor usually, and can turn malignant in rare cases. And meningiomas, they arise from the arachnoid cap cells, dural tail, benign, good prognosis. Up till and unless they are not in a precarious location. So that's it. This was given. Simple line, dural tail sign. One question which had a bit of a difference. I don't know whether it was adenomyosis, endometriosis, or it was fibroid. But this, as far as the image which was provided to be my students there, I had an image in mind, and this over here, this happens to be a tumor from fibroid. This is a leiomyoma, and you can see that it's a very large leiomyoma. You do not normally see such leiomyomas, although you can see multiple leiomyomas, but this is one leiomyoma which you can see just pressing on the bladder, as well as causing some pressure symptoms on the rectum and anal canal. Also, this is a huge fibroid. So recognize this condition, though I would be very honest in telling you that I'm not sure whether the question was a fibroid or not. Okay. Now, piriform fossa, I have been very much. I see two questions in FMG, and over here, another question, you had to identify the piriform sinus. So you had to know the anatomy of the pharyngolaryngeal complex, which is very important. You have to know what lies in the nasopharynx, what lies in the oropharynx, what lies in the laryngopharynx, all those things. So piriform fossa, where the foreign bodies get stuck, you have to remember that, and you have to correlate it anatomically. I will be coming with a detail. This is just because the questions are coming up and they're shooting up, and I'm having a eye on something else in front of me. So just to go take you through what was asked and what were your answers. So then there was a MRI which was shown as sacroiliitis, and you have to remember that sacroiliitis is usually associated with one important condition, which is the ankylosing spondylitis, HLA-B27 association, and MRI is the best modality to just diagnose the sacroiliitis. So that's very important. So it was given over here. Then there was a question, there were multiple, which I had already given, that thickening and calcification of peritoneum with jejunal loops. This patient had discomfort, most likely a mid-abdominal discomfort, and there was a case scenario of a retroperitoneal hematoma. So there was a collection behind the peritoneum, and you have to recognize which is the retroperitoneal space and what it would present with. Then, I have mentioned the pseudo gout. Then, very important question in pathology, the association of anti-SCL antibodies. A clinical scenario was given, and the question's answer was scleroderma. And another question which was given over here was anti-SSA and anti-SSB. So we had two questions from the knowledge of your, antibody profiling. So you should know the antibodies. I have given a huge list over here. I will just try to erase this thing because I just want to show you why it is important to read exactly. So anti-Smith, anti-histone, anti-centromere, always asked. You get 1 to 2 questions from this thing. So over here we had two questions: anti-scleroderma 70 and anti-SSA and anti-SSB with the features of Sjogren's syndrome, which I will be coming up. So Sjogren's syndrome, dry mouth, dry sex, dry feelings, dry eye, dry. So that's why dysphagia, dysphonia, corneal ulcers, and stomatitis and angular cheilitis, because of these conditions, because it's out there. Then primary biliary cirrhosis, just association with mitochondrial antibodies. That's it. AMA, and the question winds it up there. So again, I would not underestimate Neet PG QR, Platinum Q, Volume 1, Volume 2, and image based. I wish you best of luck in your results, and thanks a lot.